Welcome, everybody. Thank you for joining us for our next episode on our MHAC Michigan HIV/AIDS Council member highlight. My name is Ari Hampton. I am your wonderful leader when it comes to just having community conversations and highlighting our phenomenal people. And today we are joined by yet again another phenomenal person, Courtney, who will be introducing herself really shortly. And so we just want to make sure that we thank you for joining us on this episode. We hope that this is really educational, fun conversations. If there's any conversations that need to be held in addition to what we speak about today, or if there's just questions about where you can access services or how you can contact the Michigan HIV/AIDS Council or Courtney herself, then we can go ahead and get that information through our website or through our email, and then we can go ahead and respond to those. So we appreciate you all. And I'm going to kick it over to Courtney. So thank you, Courtney, for joining me today. And I'll let you go ahead and introduce yourself a little.
Thank you for having me. So my name is Courtney. I am currently a program coordinator at MATEC Michigan. I was born and raised in Michigan. I worked in South Carolina for about 8 years, 8 or 9 years, and then I came back. And yeah, so I'm here and I'm excited to talk to everybody.
Oh, that's awesome. That's awesome. And for our conversation, preferred pronouns.
I'm sorry, my preferred pronouns are she, her, and hers.
Perfect, perfect. Just make sure we always do
Yep.
respectful things and make sure we're respecting how people want to identify. All right, so that leads us to our first question, Courtney. So what makes you do this type of work? How did you kind of get into this?
So I started in 2014 when I moved to South Carolina after I graduated from Wayne State. I wanted to be closer to my family, so I accepted a DIS position, disease intervention specialist position in Anderson, South Carolina. So I literally had no idea of anything. My mom didn't talk to me about STIs or HIV or anything, so I kind of went in blind, and I'm glad I did because that's what I've been doing ever since 2014. So it's been a roller coaster, but I wouldn't have it any other way.
That's amazing. That's amazing. So first, I always say thank you to for anybody that does this work. As someone that's been living with HIV for over 16 years and doing advocacy work and making sure that we have proper and equitable healthcare services across the board for all communities, it's so important for people like you that do this work that shows up and puts a better picture of what healthcare services can be for communities like ours. A
Yes.
lot of times we're just treated as numbers, and it's folks like you that truly make the difference in making sure that people feel like we are human beings, which we are, and
Yes.
that we are deserving of equitable healthcare services across the board. So thank
Oh,
you for that. And
thank
you
you.
already kind of touched base on my next question, which is how long you've been doing this. Um,
Yes.
but I guess I can switch that a little bit more and just talk a little bit about your current position. So can you talk a little bit about what currently you do?
Yeah. So now that I'm here in Michigan, since 2023, I've been with MATEC Michigan. So we are the Midwest AIDS Education and Training Center. And so in this role, I'm kind of behind the scenes. So whereas DIS, I was in the field doing everything, now I'm behind the scenes helping with education. So I make sure that everything is ready for programs that help educate HIV providers. And then I also do HIV training for med students, like the first year med students at Wayne State. My colleague and I do that, and then a few other agencies that just need like a basic HIV one-on-one training.
Oh, that's amazing. That's amazing. I've been blessed enough to work with Maytech in previous years and currently still. I know the important work that you guys do with just making sure that healthcare professionals are adequately trained on terminology, on proper practices, on treatment protocols, stuff like that.
Yeah.
Can you talk a little bit more about just kind of like the interactions you have with healthcare professionals when you're doing those types of training? Because I think people forget a lot of times, like they think people that get degrees and go into healthcare, like that's where their education ends. And they don't understand how much extensive training does happen after the fact of getting that degree.
So just even sitting in, we'll always have yearly. There's a provider summit. So all of the top doctors, I guess, in the area will come and talk. And it's just amazing just to see them talk about different subjects. And even doctors who I know have been practicing for years and years, probably since before I was born, they're asking questions. They're still engaging in conversation. It's not like they know everything, because they don't. And they actually acknowledge that, science is evolving, HIV care is evolving. So just I can appreciate the fact that they are willing to learn and continue to learn.
Yeah, yeah, yeah. I think that's so important, especially because our volition and our initiative, as advocates that work in public health, is trying to rebuild and establish that trust between communities and healthcare services themselves. And so it's so important for what you guys do at MATEC, because you're bridging those gaps to making sure that what we're hearing on a community grass level, action item place, is what's being established with our healthcare professionals and making sure that the standards are there. So awesome. Thank you once again to you and everyone at MATEC that does that type of work, because it's so important. I guess we talk about timeline again, because I love a segue. But can you talk about how long have you been on MHAC?
Oh, actually, I joined MHAC when I with the Alzheimer's Association. So I was the HIV outreach coordinator there in 2012. I'm sorry, 2022. So I joined MHAC sometime in 22. So I've been on for this will be my third year.
We love you.
I love y'all too.
So how has your journey with MHAC to join?
So when I first started, I was overwhelmed because it was new. There was nothing like this in South Carolina, so it was a new group. I was like, okay, I don't know anybody, nobody knows me, so it's just like, hey, whatever. But as I attended meetings, joined committees, and I see everyone out like in prides or just at different tabling events. So I kind of got to know people, and every time I see you, it's like, hey. So now I feel like I belong. I love why am I drawing a blank on my committee? Right here.
That's okay. That's all right.
Community outreach. Yes. Community outreach is the committee, and Kyra is great, Safina is great. Everyone is just very passionate about the work, and that's why I enjoy being on MHAC.
Yeah, yeah. And that's one of my favorite committees. Around Impact for a long time now. But I love community. That's where I started, when I joined myself, and I was quickly co-lead of the committee. But it is the basis of what we all do that work in public health. Is our primary goal is to making sure that education and outreach is happening within the communities themselves, understanding how to show up for themselves, and also understanding what rights you have and how you can join the fight in making sure that we have equitable services across the board for the whole state of Michigan, which is one passion of mine.
Yeah.
Not just making sure there's a standard and a level for where we work in our communities. Like I work in Wayne County, like you do, for Detroit specifically. But what we do here in Detroit, and how innovative we are, should be applied throughout all healthcare systems throughout the state of Michigan. And we can definitely learn even some strategies from upper peninsulas of Michigan down here in the city itself. So I think it's a great atmosphere for us to cross-reference our techniques, our problem-solving skills, the way that we look at certain laws and collaboratively work together to try to make some effective change on a policy and preventative platform.
I
So
agree.
love that. Love that. So just touching base a little bit more about MATEC. Has there been any challenges that you guys have faced when it comes to providing the work that you do?
Um, the challenge that we have, I think, would be just the buy-in from some providers. While there are some providers who are, oh, I understand, I need to learn, my staff needs to learn. There also are some providers who just, they feel like they don't need anything. They don't need any additional training when it comes to, LGBTQ inclusive care or um, cultural competency and things like that. So Some providers are just like, we're good. So that is a challenge. And then also too, because of who we are funded by, sometimes we're limited as to what we can talk about, especially with this new administration. A lot of our topics have been kind of X'd out because we can't talk about specific populations now. So that's been a challenge, but we're navigating that.
Yeah, yeah, it's definitely a pivotal time in the way that narratives have been shifted. We understand what has worked for communities as a greater access of trust, care, pushing more services out into the community. I think there's some limitations that are happening at this current time that we're trying to navigate, which is really, really stressful. We are some great people that kind of pivot and shift at the whim of a hip
Hmm.
when things happen. We're kind of known for doing that in public health, but it's definitely challenging in the time that we're in right now, especially when we understand that research specifically surrounding certain communities and stuff like that have been taken away. And like, as you said, certain language can't be utilized because that has been deemed inappropriate by administrations and stuff like that. So it's very challenging. Totally understand that. So now, kind of talking about that and just not straying away too far from that. Um, do you have any possible solutions that you guys have been working with to try to navigate that whole challenging system that we're in right now?
At this point, no, we're still trying to just figure out. I think the what we're going to try to do is if we can possibly get around, say what we need to say without saying it, if that makes sense, and trying to figure out a way to kind of redo some of our trainings. That's the main thing. So we're hoping that we can still be able to drive the point home without saying it, because we're it doesn't seem like things are going to lighten up anytime soon. So,
Yeah, yeah, and I think that's a lot of folks nowadays is that we're looking at language and seeing, like, once again, just what's deemed not something that we can utilize within our teachings and our educations that we provide out in the community or to providers themselves, but finding a way to kind of pivot and try to mold it as best as possible so that people are still receiving equitable services that are not discriminatory in nature, anything of that, and that has bias. We understand that bias and stigma is a driving force of why people don't access healthcare services, specifically communities that are living with HIV or people that are at risk for chronic diseases. It is a huge driving force. So we want to make sure that people feel like they are seen, valued, and heard, whether that is the client themselves or the clinical staff that work in those settings, that they're not experiencing those aspects either. So there's a way that we can kind of teach, and I think you guys are doing a great job at pivoting in this nature to still provide those services, those trainings that are needed. Because and just for personal stories, like I've know all too well of bias when it comes to healthcare
mhm,
settings. I've had several experiences where healthcare professionals uh, were discriminatory and that did have huge biases, made assumptions. And as soon as they walked into the clinic room without even having a discussion with me, and providing bad medical care, which I had to file complaints about. So it is truly, truly important for the work that you guys are doing so that there is a certain level of standard that everyone has, that no one is turned away, that no one is treated as less than. So once again, you're going to hear it over and over again. Thank you. Thank you, thank you, thank you. Now I wanted to talk a little bit more about some things that you have kind of learned from working in the community. Can you highlight some just a few things? It don't have to be a huge list of stuff, but what are some things that you kind of learned from doing this work or working in the communities?
one thing, and this is a personal learn, I guess. Um, I've just learned my self-esteem has gotten to where it needs to be. Just in the beginning, like I was like, I'm dark skinned. I'm like, nobody likes me. But working in this community, the LGBTQ community, when I tell you, they are bold, they don't care. They live in their truth. They live their best life. And it's just when I see that, when I see people at Pride, when I see people giving presentations, they do not care. And I'm just sitting there like, why am I sitting here worried about what people think? If someone thinks I'm ugly, I'm dark, whatever. I need to live my best life. These people are literally fighting for their lives every day with when it comes to stigma, when it comes to just, all type of negative things, and they can still shine and be bold. If they can do that, then I can do that. And so I kind of made that promise to myself to not, I'm not going to do that anymore. So that's one thing that I will say that I've learned, and I am so appreciative because it has just changed my outlook on life.
Oh, that's beautiful. I love hearing that, because I truly believe in, and I'm a person that comes from, I have several different variables of situations, chapters of my life that I've lived. I've done drag. I've been extremely effeminate presenting. All these variables that make us who we are, and what we truly find is it is through the diversity, the special characteristics that we all bring to the table, that we truly see each other, we see ourselves in each other, and we understand what true beauty and acceptance and authenticity looks like. And so I love that, because I think that's something that a lot of people don't recognize a lot of times, is that when you have bias that is presenting itself, regardless of who you meet, what community you come into, it is inherently our own insecurities that we're battling against. And so when we able to let that shift off of us, let it drip off of us like fat, and just be like, no, I don't want it. And you
Yeah.
stand firm in who you are, we're able to fully realize who we are and show up for each other in the ways that we need to, in a bigger community aspect of things.
Yes.
Love that. Love that. Love it. So that's really, really great. So when it comes to working in this field, and seeing how Ryan White has helped communities that are living with HIV over the course of years, um, do you think things have changed recently with how healthcare services are set up for people living with HIV?
Um, so yes, especially coming from a southern state to a northern state, there are uh, where I was at in South Carolina, there literally were two HIV providers within like I would say, 100-mile radius. So there weren't a lot of providers. So moving up here, I feel like they're everywhere. And just even within the past couple years that I've worked with MATEC, I just see a lot of those LGBTQ stamp of approvals with providers. So that means that they're actually taking the steps. Not only are the providers taking the steps, but they're making sure their staff are competent as well. The front office staff, the med techs, the um, people in the lab. Like I have noticed that change. And so that's something that I'm happy about.
Yeah, yeah, that's really, really good to hear. I think we've made so many strides when it comes to healthcare services, especially in public health, and for services for people living with HIV. We work really, really tirelessly, and it's kind of like you said, because I graduated down in Florida, and that's kind of where I didn't work professionally, but I got my start in outreach and prevention work down in Florida, and so seeing the difference of how outreach and prevention, accessible services per zip code is in the southern states versus here in the north is vastly different. And so it's great to see initiatives, especially from previous years, taking special interest in making sure that southern states have expanded services and that people can access what is necessary for people to live healthy, full, realized lives. And that if you are at risk of acquiring HIV, then you can get preventable measures. If you are someone living with HIV, you can have the access to treatment services and get the care that you need to get to undetectable, which we
Right.
understand, as you will hear in every video of the highlight service. Undetectable equals untransmittable. If you are
Yes.
living undetectably with your viral load, then you cannot transmit the virus onto anyone else. So that's why it's so important that we advocate for people to get tested, to know what your status is. If you are living with HIV, get into care, get on treatment protocols. If you were on some medicine in the past and you fell out, get back into care.
Get
It's
back on.
okay. No one's gonna smack your hand. It's all good. We want you to show up for yourselves, get into the treatment services that are needed for you, so that you can have a healthy system and do all the things that you want to do. Because we are
Yes,
human beings. You are not a virus. You are a human being, and you get to live a long, healthy life.
absolutely.
So now I'm going to shift a little bit more personally with you. Can you give us some key advice? What's helped you kind of like press on in this work? Because I know it can get a little tiring. Burnout is real when it comes to servicing communities and showing up for people. It takes a toll on you when you have to deal with people's intersections of life where they are trying to find services or get to a better state of living. So what do you do to take care of you?
Um, Self-care is definitely, my best friend. I may, whether I feel like I need to read a book, taking long walks, journaling. I do enjoy cooking, so a lot of times I'll come home and just unwind by cooking. That usually helps. But also to just when I was in my previous role, I had to understand, and it takes a while because as a human being, if someone is in your face yelling at you, coming at you, you're going to feel attacked and you're going to be defensive. But in those moments, when I would take a deep breath and literally understand, it's not you. It's not you. You're the messenger. They're upset with everything that's going on. They're upset with what they had to deal with when they received their diagnosis. It's not you. So understanding that and giving people grace to be like, I'm giving you this time to be upset. If you need to yell, yell. And I think that that took me a long way because people could see, okay, she's not clapping back. They may not even apologize, but I'm still not gonna, clap back at them. So I think self-care and then that additional kind of thought in the back of my mind, like just give them grace. That kind of helps me.
That that's great, great. I love that response because it's so important. I've had to do that myself over the amount of years. I think, like I said, working in this field is so rewarding because we're serving our communities, we're serving the people of our great state of Michigan, and across the country itself. When we do our advocacy, when we do our education, when we educate one person, we understand that education flows into their communities because they're peer educators now. So it's so important. And even with MATEC, you guys are doing it on the healthcare setting where you're teaching those newly fresh medical professionals. You're eliminating that bias before they even enter into the workforce development anyway. So I think it's so wonderful how you hit on all that greatness. Um, we're kind of winding down to the end of our conversation. This has been really, really great. I love this so much. And
Yes.
I think you have highlighted some stuff that definitely I'm going to be taking back too, just reminding myself of self-care and making sure that I look at my self-esteem too and looking at how this work inherently does help a lot. So now I always like to ask people like what are some things that you would like someone who's watching this conversation to take away?
So I think the most important thing is, and I am a strong, strong, strong advocate for sexual health. Anyone who is sexually active, whether you're having sex once a year or once a day, you need to take your sexual health seriously. You need to be tested, whether that's once a year, once every 6 months, however often. You need to make sure that you're taking care of yourself. Just like you go to the doctor and have a physical, you go see a counselor or you go see a mental health professional, the same needs to go with your with your sexual health. And we need to stop making it nasty or weird. If I ask you about your status, what what you mean? What have I gotten tested? Do I look dirt? No, that has nothing to do with that. I'm safe, so I want to make sure that you're safe as well. So making it a normal conversation when you're talking amongst your friends, your sex partners, anybody, like let's just normalize sexual health just like anything else.
Love that. I love that. Sorry, my mute was not working. But I love that. You know, I was talking with someone the other day, and I think you are the perfect definition of what I was describing when I said I no longer look for allyship in my communities. I look for accomplices. I think you are a perfect definition of what an accomplice looks like because for someone living with HIV, I get burnt out a lot of times. Oh, I've been living with it for 16 years and doing this work for 13. And so
Wow.
I've been made into like, oh, someone is talking about HIV, they're making fun of somebody, da da da. Send it over to Ari. What are your thoughts on it? And it's like I get tired because I'm not just the HIV dude. I'm Ari. I am a person that is living fabulously with HIV, but at the same time, I'm burnt out too. And so it takes not allyship, it takes accomplices that truly go out of their whim in their personal lives to stop and educate their friends and families like, hey, that terminology isn't correct. So when someone says, like, oh, I'm not dirty, well, I hope you took a shower, but living with HIV doesn't mean that I'm dirty. You know, I know
Exactly.
my HIV status. I know my treatment levels. I am undetectable. I'm taking precautions on my side of things to protect not only myself, but to protect my partners. And a lot of times people don't get that people living with HIV, we're more afraid of acquiring something else from negative folks than negative folks should be of us.
Exactly.
So I appreciate you so much because that's so important. Love, love, love. Thank you, thank you, thank you. Yes, we appreciate you so much. Um, and so now I just kind of want to give you space at the end of this video to kind of let people know. So if I am a healthcare provider or if I'm a university that's looking for some type of training from you guys, how can I get a hold of you guys? Where are people able to access your services or make a request?
Yeah, so we are located in Detroit, Michigan on Wayne State's campus. So our website is MATEC Michigan. And our phone number, if anyone wants to give us a call, is 313-962-2000. And then we can also be reached at matecmichigan at wayne.edu as well.
Perfect, perfect, perfect. And just as a reminder, all of that information will be right down below in the comment section. So if at any point you want to go ahead and get in contact with Courtney or someone that works over at Maytech, then they can go ahead and get you into those services and make sure that request is filled. Courtney, I appreciate you so much. And
I
I
appreciate
just
it.
I think you have the most wonderful energy when it comes to this work. You're always a ray of sunshine when I see you, and I get so happy when I see you doing the work because I'm like, I know it's gonna get done. I know it's gonna get
And
done.
it will.
So, yes. So I just want to say thank you so much for taking the time today to speak with me so we can highlight you and the wonderful work that you're doing out in this community. And I hope that everybody takes some wonderful lessons away from this conversation. Thank you again.
Thank you.
And thank you to everybody that's watching. Stay tuned for our next episode that will be coming out soon, where we highlight another MHAC wonderful member. But please drop your comments, share your likes, share the video, all that greatness. And until next time.